What's up, everybody? Dr. Rossi, shrinksandsneakers.com. So I failed in my bid to cover all of lithium last week, although I really wanted to cover the rest of the topic of lithium for you guys. I kind of missed the boat a little bit, and that's the life of an attending psychiatrist. It's a little bit busier than it was for me as a resident. But what I can promise you guys is that I'm here for you. I want to guide you on this journey through your mental health treatment, and I'm going to complete that lithium series today. So, the last parts to talk about are the benefits of lithium and how they might help a patient, as well as the adverse side effects of lithium. So, probably the most important thing to know about any medication from the patient perspective is going to be the side effect profile. But it's also important for us as physicians to be mindful of those side effects and the ones that might affect adherence to the medication. So, with that said, lithium is associated with a broad range of adverse effects. And these adverse effects obviously will impair people's ability to adhere with the medication. Not everybody's going to like taking something that's going to cause negative side effects. So what are the ones that we want to talk about? We want to talk about sedation, cognitive dulling, which is interesting to me because in the previous videos I had told you guys that there might be some neuroprotective effects, and this might actually even work in neurodegenerative disorders like neurocognitive disorders such as Alzheimer's disease. But it also can cause cognitive dulling, so it's a paradoxical kind of effect here that we're seeing. Polyuria, polydipsia. So polyuria is excessive urination, polydipsia is excessive thirst, tremor, dry mouth, nausea, diarrhea, acne, and metallic taste in your mouth with food, as well as weight gain. So a lot of adverse effects to talk about there. Obviously, not everyone is susceptible to every one of those adverse effects. It's not like when someone takes this medication, you get all the adverse side effects, but these are the potential side effects and the ones we want our patients to be aware of. Now, there are some actually even more severe side effects, which can include things like renal problems, endocrine problems, cardiac dysfunction. So those are some of the bigger, more serious problems. And lithium is also associated with teratogenicity, meaning that it can harm a fetus during development. Specifically, it can harm the heart, and it's called Ebstein's anomaly, which is an atrialization of the tricuspid valve. So very complicated stuff, but there has been an association between lithium use, especially during the early parts of pregnancy, like the first trimester, and the development of this Ebstein's anomaly. Now, weight gain is possible. So all psychiatric medications almost have some degree of weight gain as a possibility, although it's much lower than the dopamine blocking medications. So for example, lithium is a better option for reducing weight gain than, say, olanzapine, which would have much more propensity for weight gain. So there are some benefits to getting your mood stabilization through something like lithium rather than through a dopamine blocking medication. Now, polyuria and polydipsia, so these persist in about 25% of patients on maintenance treatment. So again, excessive urination, excessive thirst, 25% of patients on maintenance treatment. So a quarter of the people who take lithium regularly could develop polyuria and polydipsia. Now, when severe, it could represent something called nephrogenic diabetes insipidus. And that's a complicated word and a complicated term, but what does it mean? So nephrogenic diabetes insipidus is a condition caused by lithium's inhibition of the kidney's sensitivity to ADH. And ADH is antidiuretic hormone. And what that normally does is that causes water to be reabsorbed into the body. And when someone is not sensitive to ADH, they're going to not be able to reabsorb that fluid into the body, and then that's going to cause the polydipsia or polyuria mostly that we're talking about here. So diabetes insipidus, specifically this nephrogenic type, is something that can develop. Again, not as common as the polyuria with the 25% of patients, but can also be something in its most severe form. Lithium can also worsen psoriasis. So if you have a history of psoriasis, you want to be mindful of the propensity of this medication to do that. You also want to be aware of acne. So if you already are prone to acne and you're worried about it, it could potentially, I don't want to say it will, but it could potentially get worse with lithium. Some of these side effects are treatable. Oversedation, cognitive impairment can be treated with controlled release formulations. Dry mouth can be minimized with sugar-free candy. And increased weight gain can be managed with carbohydrate restriction and exercise. So like I always say, people kind of knock me for this. Every once in a while I get a comment saying like, well, how do I deal with this? Like I have when I'm craving carbs and well, right. I mean, I understand that. I appreciate that. I'm empathetic to that situation, but the first line treatment for any type of weight gain is always going to be to do a diet and exercise routine, and carbohydrate restriction is a good way to go with lithium. The tremor can be treated with beta blockers if need be. Hypothyroidism obviously could be treated with levothyroxine, and that's how you would handle anybody who develops hypothyroidism while taking lithium. You wouldn't stop the treatment, you would just treat the hypothyroidism. It's readily treatable with medication. The most common renal effect is actually inability to concentrate the urine. So that's what I was saying before about this nephrogenic diabetes insipidus and polyuria, is that you can't concentrate your urine. So what happens is the urine is very dilute, and this can be reversible, of course, after discontinuation of the medication, but there's some other ways to deal with it that we'll talk about as well. Now, one of the big misconceptions that I want to clarify for people here, because I think it's really important, is there's been recent data in a meta-analysis that indicated there's little evidence for lithium's induction of renal failure. So a lot of people seem to believe that chronic lithium use leads to renal failure. That's not necessarily the facts, and based on this meta-analysis, you can see that there's actually not that much evidence to support full-on renal failure, only a small decrease in GFR with chronic use. So GFR stands for glomerular filtration rate, and this is one of the measures by which we see how well the kidney is functioning, or kidneys are functioning. So there's not as much risk for full-blown renal failure as people might have you believe, although it is something to be mindful of, and obviously some of the renal effects of lithium need to be discussed with your patient. Lithium obviously causes endocrine abnormalities, like I said, specifically things like hypothyroidism or hyperparathyroidism. So that's another one that comes up quite frequently, hyperparathyroidism, and they can occur at any point in the treatment. They are typically reversible after discontinuation, and evidence from randomized controlled trials indicate that approximately 4% of lithium-treated individuals will develop hypothyroidism. So 4% of people who take lithium will develop hypothyroidism. Lithium has a direct anti-thyroid effect, and it inhibits the thyroid's sensitivity to TSH. So twofold there, two effects. Direct anti-thyroid effects as well as inhibiting thyroid sensitivity to TSH. Now, increased parathyroid hormone, like I said, it can cause hyperparathyroidism. So this can increase calcium levels, and this occurs in 15% of lithium-treated individuals. So being mindful of these endocrine abnormalities is very important. And this is likely due to lithium's effects on the pituitary gland, leading to PTH release, parathyroid hormone release. Okay? Adverse cardiac effects. So the cardiac effects can be there with older patients. You might want to get an EKG before starting this medication. The most common effects that we're going to see is decreased conduction at the SA node. So SA node stands for sinoatrial node. And that can result in this syndrome called sick sinus syndrome. So watching out for that, getting a baseline EKG on patients who are older, and being mindful of anyone with pre-existing cardiac conditions is going to be important when working with lithium. Other effects include AV nodal block, and then non-specific changes can happen in your EKG, and those non-specific changes are really just ST and T wave changes, but they're generally meaningless in terms of their clinical significance. A word about the teratogenicity. I said before, there is some risk with lithium to cause what's called Epstein's anomaly. So lithium use during the first trimester of pregnancy has been associated with Epstein's anomaly, which is a downward displacement of the tricuspid valve into the right ventricle, also known as atrialization of the right ventricle. A recent systematic analysis, though, indicates the risk is actually lower than initially thought, but all women of childbearing age should be aware and warned of this potential risk. So it's important that we talk about that. and make people aware of these risks and the risk for teratogenicity. The last part I want to say here just briefly is just the clinical effects. So lithium is actually recommended as first-line treatment for acute mania. It's usually initiated with a medication like olanzapine, a dopamine blocking medication, because of the anti-manic effects of lithium take longer to start. So you'll see a little bit of a delay in terms of the benefits of lithium, somewhere around the 6 to 10 days. So it's best to get a medication on board that's going to work a little more rapidly, and that's where medications like olanzapine come into play for short-term use, and then you can taper that medication off and just continue the lithium as maintenance therapy once the person is no longer manic. Lithium is less effective than anticonvulsants in mixed or depressed states. So if a patient is mixed or depressed, you might want to reconsider the choice of lithium. You may want to go with Depakote, which comes with its own set of risk factors, and it's a video we're covering soon. Or you may want to go with a dopamine blocking medication. Lithium helps to prevent relapse of mania, but is not effective for preventing depression. That's important to note, that this will not affect those depressive states that a lot of bipolar patients have. A lot of bipolar patients predominantly have depressive states. They don't have as many manic episodes. Lithium's antidepressant effects require 6 to 8 weeks to begin working, and it's safer than antidepressants because I would generally consider antidepressants in a true bipolar case to be mood destabilizing, meaning they can actually harm the person's mood, destabilize that person's mood even more so. My rules on antidepressant use in bipolar disorder is that it should only be used if the person really has residual symptoms that are causing significant functional impairment and the person's already on a mood stabilizing medication and is stabilized. So if you're not on a mood stabilizing medication that's stable, then I would not recommend adding antidepressants to a patient with a confirmed diagnosis of bipolar disorder. Lithium can be effective in combination with other antidepressants for the treatment of unipolar depression, so meaning regular major depressive disorder. If you have a major depressive disorder that's severe and it's partially responsive, say, to antidepressant medications, specifically if there's chronic suicidality or risk of suicide completion, you may want to consider lithium because, again, it lowers that risk of overall suicide completion. So lithium has preventative effects on suicide. And the mechanism for that is thought to be teratogenic, meaning serotonin-based, and it also can have a reduction in impulsive behavior and aggression, which are things that are kind of I want to phrase this differently. So what I'll say is impulsivity in general is associated with suicide because suicide is an impulsive act in and of itself. It's generally, and all that means when we say impulsive is that this is actions without thinking, or you're not thinking through your actions very effectively. And of course, aggressive behavior also could lead to a risk for increased suicide. So that covers our lithium discussion. I think I covered all of the important points about lithium here in these 3 videos. If you haven't seen the other 2, check those out first, and then come back to this one to hear about the side effects and, of course, the clinical effects of the medication. If you have questions or comments, drop them below. I will try to answer them. And if there's specific videos you guys want, please let me know. I'll try to cover topics that are of interest.